Got any questions for me? JM is the key. This is John Mendoza and welcome to my vlog. Maayong adlaw ma'am, ako day si JM, usa ka junior clerk sa CIM. Unsa gani atong pangalan? Na ako diri karon para mag-internal exam. Sa kani nga procedure, akong isulod akong duha ka tudlo sa imong puwerta para i-check nato imong cervix. Pinaagi niini, may baw-an nato if hapit na ka manganak. Ato sa di-confirm unsa nga position ni baby. Okay ra ta magpa-examine karon ma'am? Place the patient in the dorsal lithotomy position. Demonstrate asepsis during the whole procedure. Put on examining gloves and apply KY jelly. Extend the index and middle fingers and flex the ring and little fingers. The thumb should be pointing up. Separate the labia with one hand. Insert the middle and index fingers of the examining hand carefully into the vagina. Cervical dilatation is determined by estimating the average diameter of the cervical opening by sweeping the examining finger from the margin of the cervical opening on one side to that of the opposite side. The diameter traversed is estimated in centimeters. The cervix is said to be dilated fully when the diameter measures 10 centimeters. The degree of cervical effacement is usually expressed in terms of the length of the cervical canal compared with that of an uneffaced cervix. When the cervix becomes as thin as the adjacent lower uterine segment, it is completely or 100% effaced. The position of the cervix is determined by the relationship of the cervical os to the fetal head and is categorized as posterior, mid-position, or anterior. Determine the consistency of the cervix as soft, firm, or intermediate between the two. Determine the state of the membranes, whether intact or ruptured. Determine the fetal presenting part, fetal position, and station. The presenting part is palpated and differentiation of vertex, face, and breech is accomplished. If the vertex is presenting, the fingers are directed posteriorly and then swept forward over the fetal head toward the symphysis pubis. The linear course of the sagittal suture is delineated. The positions of the two fontanelles are ascertained. The fingers are passed to the most anterior extension of the sagittal suture, and the fontanelle examined there is examined and identified. Then, with a sweeping motion, the fingers pass along the suture to the other end of the head until the other fontanelle is felt and differentiated. Identify the triangular-shaped posterior fontanelle and the diamond-shaped anterior. The station, or extent to which the presenting part has descended into the pelvis, can also be established. Determine the location of the lowermost portion of the fetal head in relation to the ischial spines. Sige ma'am, humanata! Sa akong pag-check, imong cervix kay 6 cm dilated and 80% effaced. Pasabot ni ini, naa na ka sa active stage of labor. Mag-monitor lang minimo aron ma-anticipate nato ang delivery ni baby. Ang position ni baby dili suhi, so gaon na ra ihang ulo. Nara kay mga pangutana ma'am? Follow me for more videos on JM is the key. Adios!